Will new laws change my Medicare copayment structure? Imagine paying less out of your pocket for your health care each year. Changes in laws can really make a difference in how much you pay for Medicare services. So, let's look at what might be coming your way. First, it's important to understand that copayments are fixed amounts you pay for services or drugs. Coinsurance is a percentage of the total cost you pay after meeting your deductible. Some plans use one, the other, or both, depending on the service or medication. Recently, there have been some big shifts. Many Medicare Advantage and Part D plans are moving from fixed copays to coinsurance for higher-tier drugs. Instead of paying a set amount, you now pay a percentage of the drug's price, which can vary a lot. This change can sometimes mean higher costs if your drugs are expensive. Starting in 2025, the Inflation Reduction Act introduced a cap on how much you pay out of pocket. For drugs under Part D, the limit is set at $2,000 each year. Once you reach that, you won't pay any more copayments or coinsurance for covered drugs for the rest of the year. In 2026, this cap will go up slightly to $2,100. Another change is the elimination of the Part D donut hole. This was a coverage gap where you paid more for your drugs after a certain amount of spending. Now, since 2025, there's no donut hole. This means you won't face unexpectedly high costs during the year. There are also specific caps on certain drugs. For example, insulin copayments are now limited to $35 per month. Vaccines recommended by Medicare are covered with no cost-sharing at all. In inpatient hospital stays, the daily copayments for days 61 to 90 are increasing a little in 2026. This is part of Medicare's effort to adjust costs for longer hospital stays. While these laws are changing some costs, it's smart to review your Medicare plan every year during Open Enrollment, which runs from October 15th to December 7th. This helps you compare how copayments and coinsurance might change and plan accordingly. Knowing whether your drugs are in tiers with copays or coinsurance helps you prepare for what you'll pay. And remember, once you hit the out-of-pocket cap for drugs, you won't pay anything more for covered medications for the rest of that year. In summary, new laws are reshaping how much you pay for Medicare. They're introducing caps, shifting some costs from copays to coinsurance, and removing the donut hole. Staying informed and reviewing your plan each year makes managing these changes easier.